Blackman.
Thank you, Madam Deputy Speaker. Clearly the Minister will understand that GPs are private contractors to the health service, similarly pharmacists, hospices and many other wonderful charities. The government has decided to make sure that the public sector is protected against the national insurance increase, and all that she has to do, or her Secretary of State has to do, is to agree that all the suppliers to the National Health Service in this vein are also protected. And that would safeguard the position, because otherwise what we're going to see is care homes closing down, pharmacies closing down, hospices not being able to provide the service. And in my constituency, we have a wonderful St Luke's Hospice that does brilliant work. I helped found it back in the 1980s. And the reality is they've told me they're going to have to reduce services drastically as a result of this. They've also had to cope with the fact that whenever the nurses and other medical practitioners get a pay rise, they are not given the money to give that pay rise, and that needs to be protected as well.
Well, I thank the honourable gentleman for his comments, and again he's supporting his local hospice, as many of us are. But he's an experienced parliamentarian. He knows that this is not simple. He knows that it's a very complicated provider landscape, and as we heard from my honourable friend earlier, many of these social care providers are owned by large equity companies as well. We want to make sure that any additional funding that's come from this budget goes exactly to where it needs to be, which is supporting patients, our constituents, where they live, where they need that care. That's why over the next few months we are continuing to talk to those providers in the usual way about the allocation of these funds.
Ellie Chan.